Hi, I'm Dr. Rajani. Thanks for joining me today. I'm talking about how you can boost your natural collagen, and a lot of people think I don't cover home devices or things you can do at home because it might put me out of business. It's actually not a big worry of mine, and you have to understand if you go into your clinic and you already look good, your clinic's going to get a better outcome. Your clinic's going to look better, their Instagram's going to look better, their YouTube's going to look better, and they're going to get more patients. And personally for me, if my patients look younger and don't need anything, I'm extremely happy to talk to them, give them a bit of skincare, and go on to the next client. So it's not a big concern, but why we're talking about collagen is it makes people look younger. And when we do dramatic things like add Sculptor or Plasma Sculpt and we inject that, it's amazing at 2 to 3 months. But a lot of people don't want injections, they're not ready. One of the interesting things, and I want to hear in the comments below, I hear a lot of people say, I want to age naturally, gracefully. I earn my lines, and there's absolutely nothing wrong with that. The difference now is we have a choice, and it can be 100% natural. You can just take care of your skin, or you can do more aggressive treatments. Today, I'll take you through what I do, what I recommend, and if you are doing a home device, what to look for. Going to touch on galvanics. A lot of people don't realize I actually had my own galvanic device that I used with my clients and that I sold over 15 years ago before it was popularized. So while there's not a lot of data on something like that, I do think it works. I'm going to touch on it, but I'm going to tell you something that's even more proven today, that's all natural, that's accessible, that many people have home devices that they can use for this, or you can get it done in clinics. Whether you want to age gracefully or you want injections, you can still get injections along with it. But the better you go in to your clinic, the better you look, the more vibrant, the more collagen and contraction of those facial ligaments for tightening, the happier everyone is. So if you find these videos useful, remember, subscribe, like, and share with your friends. I want to hear your comments, especially today, because I have an upcoming series on home devices, which ones you want me to talk about. But this one today is extremely important, effective, and it's proven to work. Now, last week's video I talked about the surface of the skin. So when we talk about collagen looking young, have to understand the surface of the skin has to reflect light. In that video, I went through IPL, CO2 lasers, ways to get rid of the browns. Today we're going a little deeper. We're going dermal, subdermal, and you could say into the fat layer, where the SMAS is. And those who get a facelift or you're thinking about getting one, you're going to hear about the minimally invasive or the mini lift, and you're going to hear about the full facelift, and it involves the SMAS layer and tightening the SMAS. That's what the facelift is all about. So if you were doing a minimally invasive or an all-natural procedure like we're talking about today, you might want to involve that layer as well, but overall collagen production will percolate through the layers of the skin to give you tightening, to give you glow, and to pull the face back to a degree. Now we lose 1% of collagen every year, and the problem is there's something called MMPs or matrix metalloproteins. And that's something like, for instance, collagenase. That breaks down your collagen, and that machinery ramps up relative to your collagen building as we age. And I talked about collagen powders, we talk about retinoics, we talk about hyaluronic acid topicals, hydroquinones, all those things for your skin. But we go to the deeper layers, we then have to say, how are we going to stimulate your collagen? And it's type 1 collagen and type 3 collagen that you want to get building. Type 2 is mainly in bones. We're not as concerned about it. But we also need the collagen to lay down smoothly. So how do we get to those layers? And from the home devices to what you might get at the clinic, a common denominator is through heating the tissues, whether you use high frequency ultrasound or radio frequency. Now galvanics, I said I'd touch on them, and in the description of the video, I'm going to put a link to my favorite galvanic at this time. If you guys want reviews on them, click the like button and also tell me in the comments. I'm happy to review them. Not a lot of data on them, but because I was involved with them over 15 years ago, I'm well versed, and just because things aren't studied doesn't mean they don't work. There's a lot of anecdotal evidence, that means individual evidence, and as that builds up, it's hard to ignore. So the galvanics don't give off a lot of heat, definitely not to get to the point of denaturing the proteins to get the actual type 1 and 3 nice smooth collagen production. The LED masks typically don't give off a lot of heat at all, although you have to be a little careful because people who are sensitive to melasma or get melasma sometimes will describe a little bit of heating from the masks that can lead to some melasma. However, we need to get deeper in the tissues to denature those proteins. I'm going to tell you exactly what temperature we're talking about because many people, you want to do this at home. You might have home devices. They are done in clinics, and a lot of times there's feedback because those devices are $70,000 plus. $200,000 to $250,000 would be about the top end. And for the rich of the rich, they can have them at home. But for many people, those devices that actually give you feedback are hard to come by. For the next minute, I want to show you what collagen production looks like underneath the skin. We talked about the surface, we've talked about the bone with the vitamin K2 and supplements we talked about a couple weeks ago, but I want to show you exactly the layer of skin we're working so you can understand what kind of results you can expect. At the end of the video, not only will I give you the temperatures that you want to achieve, but also let's talk a little bit about expectations, what it won't do. To understand it, let's look at the collagen production here. So this is going to be a demonstration of what Sculptor would be, or PLLA. So it is an injection, but the same mechanism occurs in principle. So with Sculptor, of course, we're injecting underneath the skin, but what's going to happen with heating is that denaturing of the protein. But Sculptor goes in, you can see here, it's coming through the needle. The blue particles represent the Sculptra. In our case today, we're talking about heating. But understand, and you see some collagen fibrins there, and those are kind of those brownish kind of wickets that are building there. Those are kind of fibrin collagen structures. And if you're thinking about facial ligaments or osteocutaneous ligaments, they're not really demonstrated here, but they go from the bone to the surface of the skin, and high frequency ultrasound can tighten those. So as that middle layer builds, as the collagen gets put down, as we overcome our own collagenases, which are breaking that down, and you can see where you're going to want to do those heating treatments over time, what temperature do we need to get to? And that's how we're getting into home device discussion, because externally, you don't want to burn the skin. So when we're doing it externally, we're looking for a temperature of about 42 to 43 degrees Celsius. Now that's external radio frequency. When you talk about microneedle, and you can go back and look at my 2021 #1 treatment, because that's what aesthetic practices were gobbling up, those RF microneedling devices, you can then achieve about 67 degrees, between 60 and 70 degrees, depending on the device. And of course, some of them are insulated needles where you can get to a higher temperature because you don't have to worry about affecting the external skin like you might with non-insulated needles. And I did video on the Scarlet. We also covered Morpheus, so you can watch the differences. But that's the temperature range you want to look for. Now, when you go to home devices, and why it's tough to cover them, is understanding, let's talk fat loss too, because everyone's going to say, I get it all the time, hey, I had it done, I lost my natural fat, it looks terrible. Yes, you can get rid of fat with these. And that has to do not only with the temperature, not only with the depth, but we go to pulse duration. And it's not what you think, it's a little lower temperature for longer duration. So you can target fat, and we want to target fat in some areas, just not pan fat. We don't want to get rid of all the fat in the face, but certainly the jawline, the edge of the mouth, sometimes the posterior jawline. We want to get rid of fat and then tighten in other areas, or the under eye area where we may want to preserve the fat. So yes, they can, but when you talk about home devices, those are the temperatures you're looking for. And the problem is when you get into cheaper machines or knockoffs or devices that you get from different countries, the predictability of energy delivery And if there is any feedback mechanism, which the newer devices now in clinics have, it's often unreliable at the price range, because people are, the ones you guys send me are somewhere around $2,500 to $5,500. Same with high frequency ultrasound. Now that uses pointed ultrasound where you can get deeper, hotter, so higher temperatures without burning the skin because it's focused. And now we even have parallel ultrasound. So the ultrasound goes in parallel to give bulk heating, much like, in my opinion, the radio frequency bulk heating machines. And you can see in this video, this is using what we call bulk heating. It's bipolar, so the energy goes from one side to the other. And how long do we heat it for? With this device, 42 degrees C, we want to look for about 20 to 30 minutes of keeping it up to that level, because a lot of times in the area along the jawline, I'm trying to get rid of fat and tighten the skin. That's where I use this mostly. I'll often get asked, hey, am I too old for this? I'm 60, 70, 80, 90. Am I still going to produce collagen? Just like I always say with platelet-rich fiber, when we take the blood down, spit it down, put it back in the body. If you heal yourself, you're a good candidate. And of course, the body heals itself all the time. Here's why you may not be a good candidate: because the skin's hanging down, because there's too much excess skin. Producing the amount of collagen that you can with a heating device is not going to remove the excess skin. Only a facelift will at that point, because you're talking inches of skin. So it's more candidate selection. The other question that always comes up is pain. How do you get to 67 degrees Celsius without a lot of pain, or even 42? I, of course, had all this done. 42, that can smart, okay? A lot of times we don't get the external burns now, but that can hurt. I use, for the injectable RF, so we're getting into the 60s in temperature, I use lidocaine injections. There's really no way, in my opinion, whether you're talking laughing gas or nitrous, or you're talking topical anesthetic, doesn't do much at all. Vibration won't do much at all. This is painful. So I use lidocaine injections, which isn't innocuous. I mean, lidocaine can kill people. So you have to be careful. But it's the only way I can get people to the temperatures they need to get the result. Because people come to see me, by the time you come to see me, you want a dramatic result, not something minimal. And when we're talking skincare, it helps with the surface, it can help with glow. Skincare doesn't get to that SMAS level, it doesn't get to the fat layer, or oftentimes even the subdermis. So I'll do another one on galvanic. What do you think? Let me know. What do you want to hear more about? But building your collagen naturally is very important. I put a complete playlist up here on things you can do at home to keep your skin and body beautiful, healthy, and vibrant.